Welcome to the third module in the Mid-Level Leaders in the Transition to Value program. We hope that since last time you've had the opportunity to identify ways to incorporate strategic and systems thinking into your work even more than you did before. In the last module, we hinted multiple times at the importance of collaborative leadership in today's healthcare environment. In this module, we're going to explore this concept further. We'll talk about what it looks like and we'll share strategies for effectively leading with a collaborative approach. Just like last month, you'll hear other hospital leaders share their perspectives on these topics, and we'll leave you with a few things to explore and pay attention to between now and the next module. So let's get started. One of the underlying assumptions behind the transition to value is that the innovation needed to address challenges within our healthcare system can only come from people with many different perspectives working together. Complex healthcare challenges can't be solved by just one person, organization, or area of expertise. Collaboration is key. What kind of collaboration are we talking about? We could think of collaborative relationships as being on a spectrum of integration. At one end, we might have minimal collaboration, where two or more people or organizations might share some information or sit on a committee together. At the other end is a much deeper level of collaboration, where entities make decisions together and share resources over a long period of time. The level of collaboration needed to successfully move toward value and population health is toward this deeper end of the spectrum, where people and groups make decisions together and share resources over the long term. Collaborative partnerships look different in different situations, but one thing they have in common is that they are created to support a common purpose. For example, as part of some initiatives to improve health outcomes for a specific population of patients, hospitals have mapped out patient touchpoints by identifying all the entities that a patient interacts with before, during, and after a visit to the hospital. This exercise can help to identify the strategic partners who might play a key role in improving health outcomes. Some groups working to improve outcomes for patients with diabetes, for instance, have chosen to partner with social service agencies, faith-based organizations, and mental health providers to address the issue. Through their work together, group members learn about how their partners interact with individuals with diabetes, work together to develop a vision for the partnership, and create a plan that takes all partners' perspectives into account. So that's one hypothetical example. Let's hear about some real-world examples from our interviewees.
We have partnerships with the local schools. We're in a small community, so we have several local schools that we partner with for different things. We also have a local behavioral health center that we partner with as well, along with trying to provide resources for food pantries, homeless shelters, churches, things like that. So these relationships give us additional resources to provide better, more efficient, more compassionate care, and to help those people that have those social detriments that just need that little extra something to help them take care of themselves.
We have helped other businesses with kind of their wellness programs and wellness initiatives at their organizations for their employees. So we all know that their employees are more than likely our patients. And so how have we been able to help them? So in conjunction with doing like lab testing and kind of more of like a wellness fair, we also can provide that education to them in their environment and help them understand what do the labs mean and kind of where do they go from there.
In these partnerships, there isn't one person or organization clearly in charge. Partners work together as peers rather than in a hierarchy where one person has more power than others. You can probably imagine that it takes a lot of trust to work together this way, and we'll talk more about trust in a few minutes. Collaborative leadership goes beyond partnering with peers and external entities. It also means taking a collaborative approach to your work with those who report to you. A participatory leader invites employees to participate in decision-making on a regular basis. This approach allows you to tap into the wisdom of the group, often resulting in better decisions. It also provides employees with a sense of being valued and having ownership in decisions, two contributors to employee engagement. You might be thinking this approach could have some potential pitfalls, and you're right. We'll walk through some strategies for group decision-making later in this module. In order for two or more people to truly collaborate, meaning they share resources and make decisions together on a regular basis, they must trust each other. The foundation for trust is laid when partners are each viewed as holding an equally valuable piece of the puzzle, and all parties know that they're participating in a mutually beneficial relationship. Trust is more difficult to build and maintain than it appears on the surface. One trust researcher estimates that 90% of behaviors that break trust in work relationships are both small and unintentional. So while we may have the best of intentions, we can break trust with others in ways we might not even notice. So what's the solution? While none of us will ever get it right 100% of the time, we can do some things to intentionally promote a trusting relationship with those we collaborate with. Trust researchers Dennis and Michelle Reyna have put forth the 3 C's of trust that can serve as a guide for trust-building efforts. The first C is trust of character. Trust of character is based on trust that the other person is working toward mutual benefits, rather than serving his or her own interests. Some strategies for intentionally building trust of character include managing expectations by explicitly communicating your needs and demonstrating clear understanding of others' needs, establishing boundaries by coming to a clear agreement on roles and responsibilities, delegating appropriately, meaning that when all parties agree on who will take responsibility for something, the other parties are willing to let go of it. Living up to agreements by doing what you say you'll do, and by speaking up if it becomes apparent that you will not be able to honor a commitment you've made. Working the win-win to ensure all parties benefit from decisions by acknowledging others' needs and acting with these needs in mind. And behaving consistently over time and across a variety of situations, so that others don't feel caught off guard by your behavior. Many of these strategies require a deep understanding of the other party's needs and priorities. We can't assume we know what these are. We really have to hear it directly from them. And the only way we can really hear it is to use active listening. When we actively listen, we pay attention to another person's message with the intent of truly understanding their perspective, rather than listening just long enough for us to start formulating our response. Here are some things you can do to really tune in to what another person is saying. Remove distractions as much as possible. This includes putting away your phone and avoiding looking at your computer. Intentionally focus on the other person's message. Clarify the other person's message by asking open-ended questions. Rephrase or summarize the message using your own words. And lastly, reflect the other person's feelings back to them. For more information about active listening, see the resource guide for this series. The second C is trust of communication. Faith that the other person is collaborating in an open and honest way. Ways that we strengthen trust of communication include sharing information openly without withholding details and without being asked, telling the truth by honestly sharing thoughts and feelings, admitting mistakes by speaking directly with those impacted and showing a willingness to learn from mistakes, speaking with good purpose by avoiding gossip, maintaining confidentiality by protecting private or sensitive information, and giving and requesting constructive feedback with growth of yourself and others in mind.
First and foremost, I would just really suggest to just be honest. If you don't know something, admit, I don't know, but let me help you. Let me find out. Let me see what I can do for you. If you do know something that's not quite ready for public knowledge, I also a lot of times say, we have something in the works, maybe give just a little bit of information, but say, it's not, all the details aren't lined out, so I promise you as soon as, things are set, we will talk about it and discuss it. Sometimes I will ask for a little bit of input with a little bit of information that I feel comfortable giving so that they feel like they're still affecting the process.
Giving and requesting constructive feedback, part of building trust of communication, is something that many of us struggle with. Here's one approach to delivering feedback in ways that strengthen trust and influence behavior. It involves 4 steps. First, describe the situation, the where, when, and who. Then describe the behavior. And this is important. Stay focused on the behavior, not your assumptions about the person's intent or attitude. Next, describe the impact of the behavior. What was the result? And last, ask for a response. Get input from the other person, what they remember about the situation, what are their thoughts, and then decide together on what's next. Here's an example. Imagine that you're leading a project with peers across a few different departments in the hospital, and one team member is consistently a no-show at meetings. Here's how that conversation might go. We had our weekly project meeting yesterday. You weren't there, and you've missed 3 of the past 4 meetings? Your input is really important to this project, and when your department isn't represented, I'm concerned that there are pieces missing from the decisions we make. Is there something we can do to make it easier for you to attend? Or is there someone else who could attend in your place? Notice that this example doesn't include any assumptions about the other person's intention or feelings. We haven't said, it seems like you're not interested, or you don't think this is a priority. We've just provided the facts. When feedback is focused on observable behavior and facts, it makes it less likely that the other person will get defensive, and more likely that they'll stay engaged in the conversation. And speaking of defensiveness, let's turn the tables for a minute. Remember that trust of communication doesn't just involve giving feedback, it requires asking for it as well. As a leader, when you receive feedback, whether it's asked for or not, the way that you respond is critical. If you respond defensively, you can erode trust of communication. While if you respond by showing appreciation, trust of communication gets stronger. For more resources related to feedback, see the resource guide for this series.
Yeah, so I think having difficult conversations with employees, coworkers, and even patients is inevitable in healthcare. There's always going to be things that, people maybe don't always agree with, but I think practice. And thankfully, I have a little bit of a commute to and from work every day. So you'd be amazed at how much time that I take during that commute to actually reflect on my day. And not only just reflect, but actually say things and speak things out loud. It's, you're private, you're in your car, and you can have those conversations. And so it's one thing to write it down or, to go over it in your head or, just kind of think about it when you're in the shower or something, but actually saying out loud and practicing those things has been extremely helpful for me. So I think, always I tend to seek advice from others. I'm a collaborator naturally, and so I like to hear what other people have to say ahead of time if I can try and prepare myself for that. And I think also even just kind of self-reflection after the conversation as well can help me gain knowledge and experience in having more conversations as I need to. And so, what should I have done differently? What went well? What should I do differently next time? And are all those questions that I ask myself. So really try and get to know your people as well, I think. And even in the situations where something isn't difficult at the time or something's maybe just having conversations with people and being vulnerable and just asking them questions about other things can also help you understand how you maybe should approach it in the future.
The last C is trust of capability, a sense that the other person is competent to respond to the demands of their role. Ways that we build trust of capability include acknowledging others' abilities by demonstrating respect for their talents and providing opportunities for them to develop new skills, expressing appreciation for others' efforts and contributions, seeking advice from others to demonstrate trust in their expertise, involving others in making decisions to promote buy-in and a sense of shared ownership in the decision, encouraging learning by investing in others' growth and development, as well as your own.
Keeping up to date with all of the things that are happening in the healthcare industry is a daily task. I think that I've always been someone who asks a lot of questions, and I'm not afraid to reach out to others and put myself out there and just kind of network with people. I've found that oftentimes I kind of pre-suffer and I think, oh my gosh, they're not going to respond back to me, or they don't remember who I am, or but it's amazing because people usually do, and you give them one little reminder, hey, I met you at this event and I just wanted to ask a few more questions. That has really helped me in a lot of situations. And so I think doing that, networking and communication with others, and not just when you need something, can be very helpful when working on a project. And then I think the other thing to keep in mind, and when you're asking for help or you're looking for things or resources from other entities, because I feel like that's the that's a huge asset. You know, I think oftentimes we think, oh, they're the competitor and we can't talk to them, but I have found that to not be true at all, and that people are definitely willing to help. So the thing that I always like to keep in mind when I'm asking others and I'm reaching out to them is that I should do the same when they're asking me for help too. And I know we're all busy, it takes time, it takes effort, it takes energy to send out that email, but when you have that moment of interaction with someone and they truly want to see you succeed, you just want to naturally do that for other people too.
Resources that I use pre-COVID, I went to a lot of conferences. I do my own research, sometimes on a subject when I want to know how to do something better. But the main thing that I rely on is mentors. I think it's imperative to have a mentor that you're able to bounce ideas off of, get guidance. A lot of times I'll say, I would like to do XYZ, how would you do it? And then, think about their response and then make it my own, but still taking their guidance.
Collaborative decision-making plays a major role in trustive capability, but making decisions as a group can be complicated. It takes a lot of time, patience, and careful leadership throughout the process. Here are a few tips for leading a group through collaborative decisions. Create an environment where all group members have equal input and no one member's position carries more weight than the others. Provide a safe space for group members to share their thoughts. All members should feel respected, even when others disagree with them. Withhold your own judgment. If an idea is shared that you instinctively disagree with, ask clarifying questions to understand the other person's position better. Avoid meetings before the meetings, where subgroups get together outside of official meetings to develop a plan of action. Agree at the beginning to share collective responsibility for the outcome of a decision. All group members should feel responsible for group processes and outcomes. Use appreciative inquiry to help the group identify a goal and get them started working toward that goal. If you're not familiar with appreciative inquiry, check the resource guide for this series. There's no doubt that maintaining trusting relationships takes a lot of vigilance. But even with the best intentions, we all occasionally break trust with our colleagues. So what can you do when this happens? The first thing to do is openly acknowledge with the other person that trust has been broken and your specific role in it. Next, apologize for what has happened and share what you're going to do going forward to repair the trust. And last, be sure to follow through on your commitment, because as we all know, our words don't mean much if they're not supported by our actions. It takes a lot of work to build and maintain trusting relationships, and the level of attention it requires can sometimes feel overwhelming. The good news is that there are a lot of resources in the resource guide for this module, including a self-assessment to help you think through the level of trust in a particular relationship. We've reached the end of this module. Next time, we'll explore the change process and things that you can do as a leader to minimize the challenges associated with change. Between now and the next module, we encourage you to reflect on these questions on your own and/or discuss them with your colleagues to help you think through how the information covered in this module applies to you and your organization. Which of your professional relationships have the highest level of trust? How did this trust develop? Which of your professional relationships have the lowest level of trust? Why is this? What's your biggest challenge when it comes to listening to others? What can you do to become a better listener? What do you do well when it comes to feedback? Where do you struggle and why? Think of another leader who's particularly good at leading a group through a collaborative decision. What do they do that makes them so effective? And here are some things you might consider doing between now and the next module. Identify one professional relationship that you'd like to develop more trust in. Walk through the trust self-assessment in the resource guide for this series to identify some potential areas you might focus on as you take steps to strengthen trust with this person. Practice your active listening skills during a conversation with a colleague. Afterward, reflect on the impact that your listening had on the conversation and any distractions that pose challenges to your active listening. If the opportunity arises, lead a collaborative decision-making process. Be sure to follow the tips for collaborative decision-making outlined in this module. Talk to another leader inside or outside your organization who's especially good at having difficult conversations with others. Learn more about how they approach these conversations and what they do to keep the conversation on track. For additional information and resources on any of the topics covered in this module, see the resource guide that accompanies this program. And of course, please feel free to contact us at the center anytime for additional support. And we have a request. We need your feedback. On the main webpage dedicated to this series, there's a Give Feedback link. At any time during the course of this series, or even multiple times, please go to our website and share what was valuable for you and any suggestions you have for making this series better. We thank you for joining us today, and we look forward to continuing the conversation over the next few months.